So I'm going to hand you over first to Mr. Colin Cohen, who's our management lead, and he'll give you a little bit of background now as to the methods. Okay. Thank you.
Hello everyone, my name is Colin Cohen. I work for the Primary Care Trust in the IT department, and what I'd like to do is just quickly do a sort of introduction of the work we've done, as Rod said, over about a period of 12 weeks. What we'll talk about is what the medicine is, try and say why we think it's relevant to our health community, and also update you on where we've got so far. As I work in IT, I'm very conscious of the fact that we have lots of IT systems which get made available to people, and sometimes they're well used and sometimes they're not well used. What we'd like to do from today is try and encourage people to use this particular piece of software, and I hope you'll see that it is quite simple to use. In terms of why it's relevant, I mean, you can't help but notice in the local papers all sorts of things, local and national press, about the state of the economy, and particularly the pressure on the NHS. This is an example of an item in the advertiser just before Christmas, talking about what the consequence was of people attending the A&E department inappropriately. Lots of places where if patients were seen in the most appropriate setting, we could probably use the resources of the NHS more effectively. What I also came across recently when we talked to Mia was lots of places where you find reference to the fact the world's getting a lot more complicated. This is a quote from the inquiry into the Bristol infirmary where there was the case of outcome of children having surgery there. And the quote that we picked out was about how medicine used to be simple, ineffective but safe, and now it's complex, it's effective, it's also potentially dangerous. The world is getting a lot more complicated, lots of treatments come on stream. It's very hard for people to keep on top of what the latest evidence is. So the map of medicine, as Rod said, a piece of software, we will show you it, and hopefully you'll agree that it's something which is quite straightforward to use. And it was 3 key points I wanted to make. First is that this has been provided as a framework to be able to share clinical knowledge, share knowledge between clinicians across different care settings. So it's not aimed just at GPs or just at people working in the acute sector and community services. It's intended for the whole spectrum. Another important thing is that you can localise it, and we will explain what we mean by localising, but it's taking information that tells you a bit more about what happens in the particular health community you work in. So there's a national website which is based on international evidence. It's the best evidence a group of people have pulled together, but you can add as much or as little local information as you want. And so, as Rod said, what we've done the last few weeks is try and bring together some relevant information about Tameside Glossop. And the other thing, which I think is really important, is that the website contains evidence-based information. So you will see on the screen there little symbols of little eye. And for each of those, there's information behind that. So if you wanted to know why somebody is saying that you should perhaps run certain diagnostic checks, the evidence that's been taken from places like BMJ or the Lancet will be there. Another thing that certainly I'm sure a lot of people will be conscious of is this idea about information overload. Amir kindly let me use this photograph of his surgery. And working with the Primary Care Trust, I'm very conscious that the PCT will develop all sorts of guidelines, documents and things, and we send them out. And there's a temptation to think the job is done just because you publish something. And probably just as belt and braces, occasionally they're laminated as if that really makes a difference. But no one person could possibly store in their head what is out there. Looking recently, talking to friends who work in health libraries, and I think the current estimate is there's somewhere between 30 and 40,000 biomedical journals in print across the world in English. And how could anyone possibly keep up to date with that? We've got computerised databases like Medline, but I think Medline adds between 40 and 50,000 references every month. Clearly not possible for somebody to actually keep on top of that and do their day job. So I think the map of medicine hopefully will show why that might be quite useful. What we also did, just very recently, I sent out a baseline survey because this piece of software has been made available through the umbrella of something called the NHS National Programme for IT. And I realise that's a rude word to some people, but I think it's not entirely bad. It's done some quite good things. And it's made this software available, and within the local health community, in theory, it's been available for about 2 years. But we didn't know when we started the project whether anyone used it or not. So I sent out a very simple questionnaire, and if you haven't filled it in, hopefully you've seen it, but please can I encourage you to respond, because at the moment we'd like a bigger number of responses. But this is for people working in general practice. So we asked people, do you ever use it? And 45% said yes. Of the GPs have responded, quite interestingly, 2/3 of people said that they do use it. So I think we're starting from probably a better base than we actually thought. I also asked people how frequently they use it. I apologise for if it's hard to read, but it starts off at the top there with a few times a week, about once a week, about once a month, or less frequently. So just under 40% of people look at it at least once a week. So it's actually, I think, quite a good bit of news. One of the other things we asked people was, what other online sources do you use? Because clearly at the moment there are probably more potential online sources than we know what to do with. And I know personally, whenever you search it, Google is very simple. You're searching it there, you don't know what to do with the results because you almost always get much too much. So based on the responses we've got so far, asked people what other online systems we use. By far the most common was NICE, but quite a few others as well. The Clinical Knowledge and Skills website, Mentor, GP Notebook, and some people even use the VCT website. So our work isn't totally in vain. I think we will come on to, perhaps later on, we'll talk about some of the pros and cons of math and medicine. What we'd also like to do is ask you to hold your questions to the end. We'll set aside some time to have a sort of question and answer session, so happily take any questions. At this stage, I think I'll hand over to Daniel, who's going to talk about how you access the site.